Hi, my name is Cassie Kleppel. I'm a 6th semester. Today is March 5th, it's 9 o'clock, and I'm doing my Foley insertion video. Before entering the room, I would make sure I know why I'm inserting the Foley. I would make sure I have an order. Usually, Foley is inserted for OB patients because of an epidural placement, urinary retention, or they're going to surgery. And then I would make sure I have all my materials ready when I go in the room, and then I would also check their allergies before placing it, especially for latex or iodine. Knock, knock, knock. How are you doing? My name is Cassie, and I'll be your nurse today. Can you tell me your name and date of birth? Awesome. So today we are going to be placing a Foley catheter. We're going to place this because you're going to be getting an epidural, and then once you get the epidural, you'll kind of lose sensation from your waist down, so you won't feel the urge to urinate. So I'm going to go ahead and place that, and it's a pretty fast procedure. I'm just going to have you kind of put your legs up in a frog-like position, and then I'll take a small catheter and insert it into your urethra, and it'll go into your bladder and help drain it. And then this will be removed after you have your baby. So I'm just going to raise your bed. Uncover you. I'm going to walk you through the whole procedure as I'm doing it. Okay, I'm just going to lift your gown up. I'm going to put your legs in that position I told you about. Okay. First, I'm just going to kind of clean off your area before I insert it. Cold wipe. I'm just going to wipe each side first. Cold wipe. And last one. Okay. Now I'm just going to be setting up my sterile supply kind of in between your legs, so I'm going to have you hold as still as possible while I'm setting this up and throughout the procedure. Placing a drape under your butt. You can lift it for me. I would place it a little bit under the bottom. I would be squirting my lube in here, but for the video, I'm just gonna save it. I would check hospital policy to see if I should inflate the balloon, but for this policy we do not, so I'm just going to attach it. Okay, and then I would also lubricate my end a few inches in my lube. So then I'm going to go ahead and touch you, and then I'm going to just clean off your area again with 3 swabs. So go down one side just like last time. Down the other side. And then last one down the middle. I'm about to insert the catheter, so you might want to take a nice deep breath. I'll tell you as I'm about to insert it. So, take a deep breath. 1, 2, 3. And I would insert it until I see urine come back. And once I see urine come back, I'll push it in another 2 to 3 inches. Once it's in that far, I would hold it and inflate my balloon. If the patient had any pain while I was inflating the balloon, I would go ahead and stop and then either push it in further because it's probably stuck in the urethra. And then I'm going to do a gentle tug just to make sure it's in there, which it is. Place this. I lay my patient back down. And I'm going to hang my bag onto the rail. And then I'm going to tape it to the thigh. The hospital should have clips for each Foley, but and I want to make sure it's not super tight. And then I would make sure it's draining, cover my patient back up. Make sure they're not having any pain. Lower the bed back down. And then I would document everything I did. I would document how much urine came out, the color, odor, quantity, how the patient tolerated the procedure, and then I would wait until the order to remove it.